Thank you so much for coming out this morning to our first town hall meeting in our brand new town hall of the Corner Brook Long-Term Care Facility. Fantastic. We've got a lot of enthusiastic people here this morning, and throughout Corner Brook and Western Newfoundland. I came here this morning to pick out my room down the road. It is absolutely beautiful. Just a couple of points that I will highlight and get to the nub of this, and to ask our Premier to come forward and say a few words. I just want to say, my own tour of this, I've been following the construction of this as the MHA for Corner Brook very, very closely. This is a dream come true. This facility is absolutely incredible, as you have seen yourselves, and we'll be able to tour even further. You know, just the level of detail to the design and to the delivery is exceptional. Everything from just the capacity to have double occupancy within some of the rooms so that couples can still don't have to feel or don't have to be separated and alienated from each other. The just capacity for end-of-life care above and beyond and outside of the palliative units. Things like the warmth and comfort of the kitchen, the dining halls. All of these are details that are really worth seeing. It's also worth noticing the incredible level of investment into the fabric of the building. It is over-engineered. It is over-designed. And on purpose, and it was a good way to do it, because this is a facility that will have a life cycle well beyond 30 years. So I'm not going to say too much more, except to welcome each and every one of you and acknowledge Mayor Jim Parsons and his council members. We've got Jeff Keshin, our Vice President for Grenfell Campus is here. We've got community leaders here. We've got people who stood by this facility and made it happen from the community and made it a ground-up effort. And that is our committee, our long-term and our hospital committee. And I want to thank Israel and everyone who was very much a part of that effort. I also want to thank the people from Western Memorial Regional Hospital, the incredible professionals who stood by this project every step of the way. So I'm going to give a quick voice to something here, and that is, we all understand and appreciate where the cynicism was rooted in this. Nobody should take those words back. Some suggested we would never get here today. Some were adamant that message needed to be reinforced, that we would never get here today, that this was just simply a political notion or a dream of just some talking point. We are here today, and we're here today because a team of people put their backs behind an effort and made it happen. And for me now, it's my absolute pleasure to introduce the Premier of Newfoundland and Labrador, my friend, Premier Dwight Ball.
Well, good morning, everyone. And as Gerry said, there was no question. There was a few naysayers who said that this would not get done, but we had the support of a lot of people in this room and the support of members of our House of Assembly. And I want to acknowledge, of course, Gerry being instrumental. Conversations going back with Gerry, even when he was an MP, it's led us to where we are today. And of course, Minister Haggie and Minister Crocker and Minister Mitchamore. And I see Eddie Joyce as a MHA for Bay of Islands, Humber Bay of Islands, who was instrumental as well. And back in opposition days, many late nights, many conversations with our group of people on the West Coast, making sure that where we're here today, this is not something that has happened overnight. There's been many hours of communication with people like you in this room. So when I say this is a team effort, it certainly is, but I'm very pleased to be able to lead this team to where we are today. This is a reality, and for those naysayers who said that we would not be here, well, we are here. And as Gerry said, we are in the town hall. It's a great way to actually start this morning. I said to people, when you walk into this building, there's a different feeling here. This doesn't have the feel, the look of a public sector or a public building. This is not the type of building that you would see governments build. The finishes are different. The look is different. It feels more like I was telling somebody this week, it feels almost like a hotel. I did get the opportunity to visit some of the rooms. But we are here, and I'm excited to be here with you today to share in this announcement. It's been 3 years ago. We made the announcement in court. Look at this. We would announce, and we announced the 145-bed long-term care home. We made that announcement. There's some questions that I was asked immediately, just a few feet away. People were asking about, well, you know, what about this public-private partnership? What does that look like? What about the jobs? What about the construction site? And what will happen once this building is opened? Well, 3 years later, we're sitting in this modern, new, state-of-the-art long-term care home. Construction is completed. It's been completed on time, and it's been completed on budget. And I'm very happy to know that the building that was built for Newfoundlanders and Labradorians, it was built by Newfoundlanders and Labradorians. Consistently, over 90% of the workforce on this building were Newfoundlanders and Labradorians. So what about the employment once the building is built? 150 new positions for this new modern building. 60 more full-time equivalent staff will be transferred from the Western Memorial Regional Hospital. The cost, $120 million. That's $14 million less than you would see government building this in the older traditional way. So in other words, this partnership was the right decision. It was the right decision for the taxpayers in Newfoundland and Labrador, and it was the right decision for people that will require long-term care services in the future. It's a modern building. It's brand new. This is not a facility. This is a home. This is a long-term care home. We did get the opportunity to tour this building a few weeks ago. The views are just incredible. And so will the services that will be delivered inside of this building. They will be incredible as well. 120 long-term care beds, 15 palliative care beds, 10 rehab beds, physiotherapy, occupational therapy, dietary services, but also real common areas where people can sit and have a game of cards and can share a cup of tea. That's why it's like a home. So when I look around the room today, I see many people here, a lot of familiar faces that were in the room just 3 years ago, and people that know that they know people in their community. I know people in my community that will need long-term care services, people that are concerned about their friends or neighbors or colleagues, people that they would have worked with over the years. Well, this is what this home is for. This home will be for them. But I also know that there are many people now that are receiving those services at the acute care hospital at Western Memorial. They will soon move into their new home. Western Memorial, the staff at Western Memorial are becoming very familiar with the new surroundings, with the equipment, the rooms that will be the home for those that require the services. Furniture and beds will move in over the following weeks, and residents will be moving in later this spring. This will make more beds available to other patients at the hospital. As we all know, Dr. Haggie, very familiar, given our backgrounds, that we have a lot of people that are sitting in acute care beds that are ideally suited and should be receiving services in long-term care beds. Also, on your drive in today, I think you would have noticed the new hospital is under construction. Once again, this is something that people said that you could not do in the environment that this province is in. You can look for yourself. Their work is continuing. And in a few moments, when you get the opportunity to tour this home and view the construction site from upstairs, you can see firsthand what's happening with your new hospital. Ladies and gentlemen, seeing is believing. And you will see what's happening next door, and you will see that later today. And when the snow clears, you will see more people working on your hospital. Work will continue for another 3 years, and by the time we reach the end of construction on the new hospital, an estimated 1,000 jobs would have been created. Some of those people would have been workers as they come into the city, come into Cornwall in this area. They will be using services that are in the Cornwall area. Places to drive, places to accommodations, places to shop. This will have a significant impact, significant economic impact on all of the West Coast. But it's just not the West Coast. We're doing something similar in Gander and Grand Falls, Windsor with the construction of long-term care sites. They will be completed next year. And on top of that, one thing that I'll be very proud to be able to say that we started and we will finish the replacement for the Waterford Hospital in St. John's. It's a new mental health facility. The one that's being used today opened in 1855. That will be done as well. And we will use the same partnerships that we use there as we replace this antiquated, outdated infrastructure across our province. So ladies and gentlemen, I want to thank you for joining me here today. I've already toured the building, as I said, and so I'm excited to get your feedback. Also excited about the number of jobs that this hospital, that this new long-term care home and this new hospital will contribute to this region. Ladies and gentlemen, I look forward to the few weeks when the front doors of this new long-term care home will open and people will take up residence. And family and friends that are in the areas that we live will not need to worry that the services will be available, some of the best modern services that you will see anywhere in this country. So thank you very much for joining us here today. This indeed is a remarkable achievement. Remarkable because of people like you in this room, but also remarkable because we have had great partners in making this the success that it is. So thank you very much for all your contributions.
Thank you so much, Premier. It's it's very inspiring, and it's also a model for things to come. This is a new way of doing things. It's a progressive model for construction. We've always had progressive people here in this town, and some of the most progressive people that I can think of are at Western Memorial Regional Hospital. If there was one story to be told here, and I started it just a few seconds ago, or earlier, but there's one group of people who never, ever gave up in planning and researching and designing, despite all the changes over the years, over a period of almost a decade. And that is the incredible professional staff that we have amongst us that will continue to be amongst us in this building here, because this will be run by professional public healthcare workers, and that's important. So now, giving voice to those incredible group of people, it's my pleasure to invite CEO Cindy Davis to come and speak on behalf of all of her team, but as well, I'll give her the plug. I want to thank Cindy for all the work that she did in her own leadership. Cindy, the floor is yours.
Thank you, Minister Byrne, and thank you all for coming today. I want to acknowledge our guests that are here with us today, Premier Ball, Minister Byrne, Minister Haggie, Minister Crocker, Minister Mitch Moore. It's such a great occasion for us. And as I look around the audience in terms of the people that are here, I can't help reflect but how important this is to so many people. So I see MHA Joyce, I see our mayor, Jim Parsons, I see the Community Action Group, Israel Han and his team, our board chair, Bryson Webb, and many members of our board are here as well. Community groups, our community partners, Grenfell Campus, the list just goes on and on. Our hospital foundations, our regional foundations that work on behalf of everybody in our region, and then so many of our partners in terms of our plenary group, our transportation and work staff. And it's a day really of celebration for us. It really is. This is a beautiful building, but more than that, it's a testimony, I think, to hard work and dedication. And so we can't underestimate how much time went into this today. When I walked through the building on several occasions with people that had been involved in it, what you hear over and over again is, we did this, we did it. I remember how we made that decision. I'm so proud to see it come to life from what I saw on paper. And the dedication of people in our region is outstanding. It makes me so proud to be the CEO of Western Health. And for people in our region, you should be very proud of how hard people worked on your behalf, whether it was government, healthcare, construction, transportation and works. The list goes on and on. As you walk through the building today, and hopefully you'll get an opportunity to do that, the engagement piece was really important to us. So when you look at the colors, when you look at the artwork, when you look at the spiritual spaces, both inside and outside, and some of the design features, know that wherever possible, we engage people in that decision making. We had people in long-term care, our residents, their families, people that are existing within acute care, their families, people that had been had loved ones on palliative care and rehab. Everywhere possible, we asked them what they felt we needed to be doing. And I think somebody has commented already today in terms of the colors of this building. The colors are very calming. It's home. And those colors were selected with many, many people inputting in terms of what they thought this building needed. So thank you very much. And so what I would say is, as you walk through, hopefully you understand this is as much as your contribution as it is for anybody else. What I would also say is that the engagement of our government, particularly under Premier Ball and the government and the officials that we see here today, we can't thank you enough in terms of your ongoing commitment to the facilities on the west coast of this island. What you see today is success because of your support for us. And also, hopefully, when you look out the windows, when we get upstairs, you'll see the progress of the new acute care building. That, again, is a testimony to your commitment to us and to healthcare in this region. And so what I would finally say is that many, many times we take a lot of work to reach a point, and we don't sit back and celebrate our success. And so what I would say to you as you walk through the building, please celebrate your success, celebrate your partnership with us. We want to thank you, and we look forward to our future in this building.
Thank you so much, Cindy. It's, brilliant path to go down, and the journey has been challenging, but the view is now quite extraordinary, and we are here. It has been quite a journey. And while we celebrate now, those who came in just more recently are builders, the people who really helped with, just put their back into this, and you can see the product of their labors. I also want to point out a group of people that are going to be in the books for a long time as innovators, and that's Corey Grandy and his team at Transportation Works, his entire team, who are now feted across the country and spoken of in case studies about how to do it and do it right. This design model, this construction model is now really, we are teaching others how to do that because it got done right. I said earlier that the building is somewhat over-engineered, which is a good thing. And it is, because the builders themselves, our team of constructors, the plenary group, did that very deliberately because it was a solid business case to do it, and we enjoy the proceeds of it. So now, to reflect on the experience of the plenary group and to continue to welcome the plenary group to our community, to our province, and to projects, I now ask Ryan O'Connor to come to the microphone. Ryan?
Thank you, good morning. This is where the excitement begins with the keys. Thank you all for joining us. I mean, what a great milestone. The Premier mentioned that it's been 3 years in the making, and I know it's been more than that for several of you out here. And I would note that when we were awarded the contract, we had committed to about 25 and a half months to reaching substantial completion on time and on budget, and we did that, we achieved that. And it was achieved through the collaboration between the public and private sector, and without the leadership of Transportation and Works, Western Health, the Premier and the ministers, that never would have been possible. So again, thank you very much for that, and we're so thrilled to be standing here delivering on time, on budget, the first public-private partnership for a healthcare facility in Newfoundland and Labrador. So thank you. And again, in talking about collaboration, there is collaboration on the private sector side as well, and I'd like to thank our partners at Marco and Cal, the ones that actually had the boots on the ground here with the local labor force to deliver this project. And fortunately, I'm the one that gets the glory today in handing over the keys, but it's really, it was that local contribution that delivered this project on time and on budget, and we'll continue to operate it behind the scenes seamlessly on a non-healthcare basis for the next 30 years. So we look forward to that. And with that, I would like to hand over the key to the front door, I believe. To the Premier.
Over here, Byrne. We should do come over here.
Come out here. Cindy, I think.
Yeah, we're going to come over. Okay, good. All right, thank you. Thank you. Now, Cindy?
Oh, you get the key.
I
Thank you. Thank you. I think you're in good hands. Thank you.
Excellent, excellent.
Thank you so much.
Thank you.
Thank you. So that concludes our first town hall meeting in the brand new town hall at this wonderful facility, so at this wonderful home. So with that said, thank you all once again for coming out. Thank you for being a part of quite a legacy and a success story here in Brook and for Newfoundland and Labrador. Please take advantage of the tours that are available to you. We had a tour 2 weeks ago, and I just had another one. Things are just moving along, but what will just inspire you is when you see the level of detail that has gone into this construction, this building, in its design, you will be blown away. So with that said, God bless each and every one of us, and thank you.
Yes. Yes, we'll get this.
You know, one of these people who loses his keys. My wife's always losing. I got one of those little tile things on it. Actually,